Welcome to our webinar entitled Lifestyle Tips for Glaucoma Patients. My name is Richie Kahn, and I'll be your host today. I am a patient myself and absolutely thrilled that the Glaucoma Research Foundation has invited me to participate in today's webinar. I'm looking forward to what I know will be an enlightening webinar presentation, and I can't wait to pick up some exciting lifestyle tips for living with glaucoma. As you may know, this week we are celebrating World Glaucoma Week. It was originally created by the World Glaucoma Association to raise awareness of glaucoma. In addition, the American Optometric Association has declared March Save Your Vision Month, and the American Academy of Ophthalmology has named March Workplace Eye Wellness Month. So a number of reasons to celebrate. Without further ado, I'd now like to introduce Dr. Sarah Van Tassel. Dr. Van Tassel attended Weill Cornell Medical College in New York City, where she also completed her residency in ophthalmology. From there, she went on to Duke in lovely Durham, North Carolina, where I'm located, to complete her glaucoma fellowship. Dr. Van Tassel is currently the director of both the Glaucoma Service and Glaucoma Fellowship programs at Weill Cornell Medical College. Please welcome Dr. Van Tassel.
Thank you. I'm so glad to be here. It's such an honor during World Glaucoma Week to be celebrating with you and also working on strategies to try to preserve and restore vision. So as was mentioned, I'm going to be speaking about diet, exercise, and lifestyle as it relates to glaucoma. So it comes up frequently in my visits with my patients that they say, often at the very end, "Hey doc, is there anything else I can be doing?" And I think that's such an important question, and that's what we're going to tackle today. But I think to really fully answer that question, it's important to briefly review what is glaucoma. Glaucoma refers to a characteristic pattern of optic nerve damage. To see well, you need to have a clear cornea, which is the front of the eye. Then light enters the lens inside the eye. It then hits the retina, which is like the film of the camera. And then that visual signal is transmitted along the optic nerve to the brain. And so the optic nerve is sort of like an electric cable responsible for transmitting the visual signal. And when this optic nerve is damaged in a characteristic pattern, we call that glaucoma. And although we sometimes erroneously refer to glaucoma as tunnel vision, over 50% of patients who were asked actually picked this image to most describe what living with glaucoma was like to them. So it's not necessarily that your vision starts to tunnel, but places in your vision, key elements start to become blurry or gray or hazy. And those spots that are missing can actually start to approach the central vision, which can be very, very impairing. And we can't make these areas of vision loss go away. So the treatments for glaucoma are aimed at trying to reduce them from growing or getting blurrier. And to date, the only thing we know how to do to prevent glaucoma from getting worse is to lower the intraocular pressure. And we can do that with eye drops, we can do that with laser, we can do that with surgery. And right now, it's the only target of glaucoma therapy. And I mention that because I think most glaucoma specialists would agree that it's not the only target of therapy for glaucoma. It's just the only one that has been demonstrated clearly in clinical trials to be something that we can prescribe a medication for or do an intervention for. So when I'm talking today about exercise and stress and sleep and diet, we're going to focus both on strategies that lower the intraocular pressure and also on some strategies that play into the roles of glaucoma that we think are related to progression. So with that in mind, I want to talk about exercise, stress, sleep, diet, and smoking. First, exercise. I chose to put this first because I think it's one of the easiest things to potentially change if you're not already doing it. Get moving. If you are exercising, keep exercising. If you're not exercising, all aerobic exercise is associated with lower intraocular pressure. And we know that that benefit of intraocular pressure lowering extends beyond the period of exercise itself. And something as simple as walking can be helpful. We know that in patients that were surveyed, patients with self-reported exercise habits had slower visual field progression. This, of course, is a visual field test, which most of you have taken. And what we want is for it to not be progressing in the direction shown here. And patients who exercised had less progression. It comes up very often, and in fact, it was coming up in the Q&A panel before we started. What types of exercise are best? And I think any type of exercise is great, but I want to speak specifically about swimming and yoga. Swimming is a wonderful form of low impact dynamic exercise, but I think there are two really important considerations associated with swimming. The first is that if you've had a bleb forming glaucoma surgery, swimming can be associated with an increased risk of infection that can be very devastating. So if you've had surgery, you should speak with your doctor before starting a swimming exercise routine. If you're discussing surgery with your doctor, it's critical that you mention to them whether or not swimming is part of your lifestyle and your enjoyment and your exercise, because it might actually change the surgery that they think is most appropriate for your eyes. The other thing to mention about swimming is to be really careful with the goggles that you choose. I don't have a specific brand recommendation, but what you want is goggles that really sit on the bony orbit of your eye so that that's where the pressure is. You don't want them to be against the soft tissue part of your eye because that pushes on your eye and can elevate the eye pressure. Next, yoga. Yoga is also a wonderful form of exercise, but we know that yoga exercises with head down positions were associated with rapid rises in intraocular pressures when this was studied. And this happened both in eyes with glaucoma and in healthy eyes. Thankfully, the pressure returned back to baseline within a few minutes of the head down position. And the greatest increase was observed in Adho Mukha Savasana, which is the downward dog position. And you might say, well, does this mean I shouldn't do yoga or I can't do yoga? And I would say precisely the opposite, actually. If you've taken a yoga class, you know that one of the first things a good instructor asks is, are there any injuries that I should know about? Does anyone need help making modifications? I think yoga is really amenable to making the modifications you need to make it both an enjoyable experience for you and also a safe one. So maybe you spend more time in chaturanga than in downward dog. But I think the benefit is still there. And Dr. Lin is going to talk about meditation in particular and eye pressure. And so I think yoga is still a great option for people with glaucoma. Next, I want to transition to glaucoma and stress. There's a brand new paper on this topic, which is why I think it's hot off the press. Historically, we have told patients that stress is probably related to pressure, but it was hard to pin down great evidence. And so I think our party line was just that it's best to live the healthiest lifestyle that you can live. But now we know from the November-December journal Ophthalmology Glaucoma that in healthy eyes, a very rigorous public speaking task that has been validated in the literature as a metric for stress was associated with elevated intraocular pressure. And this was similar to a study years ago that used mental arithmetic as a proxy for stress. So Dr. Lin, as I said, is going to talk more about meditation, but I do think that eliminating stress to the extent that we can and developing habits to control stress, which is more likely than eliminating it, is important for our eyes. Next, I want to talk about sleep. This table here on the left shows men in blue and women in green and the various numbers that are slept over the course of one's lifetime. And in general, you can see here that people sleep about a third of their life, approximately 8 hours a day. And that's a lot of time of one's life spent sleeping, which is particularly interesting because your intraocular pressure is higher at night and it's higher in the laying down position. So this has real implications for people with glaucoma. What we know is that if you sleep on your side, you may have higher pressure in the lower eye, meaning the eye shown here on the bottom has higher pressure. We also know that sleeping face down can elevate the eye pressure, and this is perhaps because of pressure through the eyelid from the pillow or sheets. Changing the way you sleep is really challenging, but if this is modifiable for you, there is some data to suggest that the optimal position is probably sleeping on your back with a pillow such that your head is 15 to 30 degrees above your heart. The other thing that's important about sleep is that your systemic blood pressure tends to decrease overnight. And that may sound like a good thing, but it's not. I've already told you that your eye pressure is higher overnight. And there is a growing body of evidence to suggest that this imbalance between the high eye pressure overnight and your low blood pressure overnight may be substantially related to glaucoma progression. Dr. Lynn's going to talk a little bit about blood pressure in general, but we know that this nighttime period is a part of the day when eyes are particularly vulnerable. And so the thing I tell my patients is to make sure they're talking with their cardiologist or their internist about timing of when they should be taking their blood pressure medications. I try to encourage all my patients to make sure they have an arrangement such that they aren't taking their blood pressure medication right before bed, because that's the last thing I want them to do, knowing that their blood pressure is already going to be lower overnight. And there are therapies on the horizon specifically directed at this overnight eye pressure. Next, I want to speak briefly about diet and nutrition. Eating healthfully is very important for all of your bodily systems. We know that a diet rich in fruits and vegetables in particular can be helpful for glaucoma risk reduction. A very large study showed that a diet higher in dietary nitrate, which is found in leafy green vegetables, was associated with a lower glaucoma risk. So this doesn't mean people who already have glaucoma. This is people with no glaucoma. They were less likely to get glaucoma if they had a diet rich in dietary nitrates. And the waters are a little murky with respect to specific supplements, and Dr. Lynn's going to discuss that in detail. Finally, I want to talk about smoking. Cigarette smoke has over 40 carcinogens. It has carbon monoxide and many other undesirable compounds. If you can do one thing that benefits your eyes and your body, quit smoking if you're smoking. We know that cigarette smoking is linked to many illnesses, cataract and age-related macular degeneration. And we know that in smokers, the heavy smoking, as defined by a greater number of packs per day, was associated with a higher odds of glaucoma. Vaping is a little bit less clear. We still need high quality data about vaping, but what we know is that vaping is highly unregulated, and vapors may actually get more levels of nicotine. So I think vaping has been shown to help some people reduce their cigarette consumption, but I certainly wouldn't take up vaping if at all it can be avoided. And finally, no talk about lifestyle is complete without mentioning marijuana. We know that marijuana can lower intraocular pressure, but the challenge here is that it has side effects and that the duration of action is short. We also know that you can develop a tolerance to the pressure lowering effects of marijuana. So this is the position statement from the American Glaucoma Society. I think sometimes patients get the wrong impression that glaucoma specialists just don't want them to be using marijuana. And I don't think that our relationship should be antagonistic. I think the data just doesn't support right now the use of marijuana for a glaucoma indication. And a lot of brilliant people are trying to figure this out better to see if some of the ingredients can be harnessed in a therapeutic way. And we may see that in our lifetime. So thank you. I look forward to Dr. Lynn's talk, and I'll look forward to Q&A.
Thank you, Sarah. That was very informative. Next, we'll be hearing from Dr. Sean Lan. Dr. Lan graduated from Tufts University School of Medicine. He then went on to the University of California, San Francisco, or UCSF, for his ophthalmology residency and glaucoma fellowship. Dr. Lan has served as professor of clinical ophthalmology at UCSF, as director of the UCSF Glaucoma Service, and at the Zuckerberg San Francisco General Hospital. He is currently co-research director at the Glaucoma Center of San Francisco. Please welcome Dr. Lan.
Hi, thanks, Richie. I welcome everybody to this symposium. I really enjoyed Dr. Van Tassel's talk, and I hope to add more information to what you've learned from her. And my talk will be about alternative therapies for glaucoma. And I don't have any financial interests related to the topics that will be discussed here. These are just my general financial interests. And what I want to start off with is to let all of you know, that the only treatment that we have, only proven treatment, as Dr. Van Tassel had said, is lowering your intraocular pressure, whether that be through medications or through laser or surgery. But I want to emphasize that that's the only proven treatment, and that should be the basis of how you're treating your glaucoma. What we're going to be talking to you about today, or have been talking to you about today, are things that you can think of that can be supplemental, may be helpful. And I emphasize the maybe part, but I think it's certainly worth further investigation, and I hope that the information will be helpful to you. So I'll be talking about Ginkgo biloba. There's been a lot of research about that for glaucoma. Memantine, which is the only drug that has been investigated for neuroprotection in a large FDA trial. We'll also touch on acupuncture, meditation, blood pressure has been discussed already, as well as other supplements. And that's where you may find the most interest, is whether other supplements may actually help glaucoma. Now, Ginkgo biloba has been studied for many years now, and there's numerous publications on there, probably 100 or more publications about Ginkgo and glaucoma. It is a herbal medicine. It comes from the leaves of the Ginkgo tree as opposed to the actual fruit. So I want to make that distinction. It's really the leaves that may have therapeutic benefit. And they have a lot of bioactive compounds in there, some of which are unique to the Ginkgo plant. So there may be something special about Ginkgo that may be helpful for certain other diseases and possibly glaucoma. It's been used in traditional medicine, or in, I should say, in herbal medicine for at least 3,000 years. And the other diseases or processes which has been studied for include in Alzheimer's, probably even more literature in the Alzheimer's the field than in glaucoma, as well as vascular diseases, as well as potentially dermatological diseases such as atopic dermatitis. The mechanism of action of these bioactive compounds include antioxidants, strengthening your mitochondria, inhibiting apoptosis, which is cell death, and improving blood flow and preventing clot formation, which is also a possible downside of this in terms of potential side effect, which we will discuss further. So the Ginkgo biloba extract, most studies have shown that, that it probably doesn't ultimately benefit glaucoma. That is more recent studies. It got a lot of excitement in the beginning because some initial studies show that there was some potential benefit in glaucoma, maybe even improving the visual field. A well-known study many years ago, it's almost decades now, that has shown that people who took Ginkgo 2 weeks later, after testing them with the visual field, their visual fields actually improved. Now, some of that is speculated to be because there's increased blood flow to the brain. Maybe their performance on a visual field just neurologically is better. So there may be a little bit of confounding from that end. But most of the more recent studies have shown no benefit of Ginkgo biloba, and I've been a little bit less excited about mentioning this to patients who ask me about potentially other benefits or other compounds that they could use besides lowering their eye pressure. So the bottom line is the jury is still out about Ginkgo biloba and whether it has any benefits in glaucoma. And I do want to put a little warning out there that it may increase your risk for bleeding, as we discussed. And so if you're somebody who's already taking aspirin or blood thinners, it may enhance that and prevent you from clotting adequately if you have a certain bruise or if you need to clot for whatever reason. So just a little bit of warning that there are potential side effects with Ginkgo biloba. Memantine, as I mentioned, is a drug that has many decades of experience in Europe. There are also supportive US clinical trials for dementia and Parkinson's disease. So these are neurological diseases which it has some benefit in. And there was some early animal data and early sort of preclinical data that maybe it's useful for glaucoma. So Allergan supported this very expensive study. I was one of the investigators for it. And I had a lot of hope that this could be our first neuroprotective agent in glaucoma. That is an agent that would protect the optic nerve, but without necessarily doing that through lowering your eye pressure. There are some side effects of this, including dizziness and headaches. Unfortunately, after 5 years of follow-up, the study found that there was really no benefit from taking memantine compared to placebo. So it really didn't meet its endpoint. And a lot of disappointment. I hope this doesn't discourage other drug companies or others from continuing to investigate neuroprotective agents. I don't think so. There are a lot of companies still looking for neuroprotective agents in glaucoma, but this was a little bit of a disappointment, unfortunately. There was some thought among the investigators that perhaps we enrolled patients who were too advanced in their glaucoma, and therefore they really couldn't benefit from the use of memantine. Most people have very advanced glaucoma that perhaps could not be rescued. I get a lot of questions about acupuncture, and I'm sure many of you have probably wondered whether acupuncture, which seems like it's a good treatment for many diseases and perhaps for pain relief as well. And there are many studies out there. This is really probably the best study that's out there in the literature, and this was conducted at UCLA by our colleagues. And I'll just kind of run through the information a little bit. So what they did was they took people with glaucoma and they actually randomized them to either getting acupuncture at eye-related acupuncture points or non-eye-related acupuncture points as a control. And then they crossed them over to see if there was some thing they were missing from one group versus the other. And they measured eye pressure, they measured the visual fields, and measured parameters related to their optic nerve to see if there was any effects basically on glaucoma. Here are the non-eye related eye points where they had placed the needles. As you see, most of them are on the lower extremities in this case, and were not felt to have any effect or would have any effect on the eye. Here are the eye-related acupuncture points, and it's funny, I've given this talk several times, and people often ask, well, I noticed on your slides that there are points that were right there in the eye. Did they stick the needles right in the eye? And thankfully, they did not. That would really lower the eye pressure, but not in a safe way. So these were probably on the eyebrow, is some of the eye-related acupuncture points. And the take-home points from this study were that there was no overall effect on the eye pressure, the visual field, or the optic nerve tissue in the scans. And in fact, there was a slight increase in eye pressure after each session of acupuncture. And the blood pressure was lower in the group that received non-eye-related acupuncture points, and which is probably a negative thing to lower your eye pressure or blood pressure. And so overall, there was no benefit in terms of glaucoma for these patients receiving acupuncture. Now, this one I'm a little bit more excited about, and Dr. Van Tassel's already touched on this a little bit with supportive evidence that basically stress is probably related to glaucoma and perhaps glaucoma progression. And so the other way of looking at this is, well, if we try to reduce stress, for example, through mindfulness meditation, can that help your eye pressure and help your glaucoma? This is probably the best study out there on that fairly recently that came from India. Dr. Tanuj Dada is a glaucoma specialist and a good friend. And he did a randomized controlled trial looking at glaucoma patients and randomizing them to either receiving meditation, mindfulness meditation, or not receiving it as a control group. And by the way, the mindfulness meditation was for 1 hour each morning at 8 a.m. So this was serious meditation here. And here are the results, and I'm going to walk you through it. There's a lot of details here, so it might seem like overwhelming, but I'm going to walk you through it. I think it's very interesting. Here at the upper left-hand corner, you see the intraocular pressure and how it changed before and after the meditation. And the group that received meditation are the lighter color bars here. And you see afterwards that the intraocular pressure was substantially reduced, over 4 millimeters of average pressure reduction after, at the end of the study in the meditation group. And the group that did not receive meditation, their pressures were the same. Now, these boxes that are to the right, such as BDNF, beta endorphins, these are factors that they measured in the blood that would be potentially positive or good for the support of the optic nerve. And there's some evidence, preclinical evidence that, for example, BDNF is something that can help retinal ganglion cells in glaucoma. As you can see, that went up after meditation. So did the other factors, including beta endorphins. And so that's the positive effect of meditation. Here you see in the middle panel of rows here that these are some perhaps what we might call negative factors or toxic factors in terms of the optic nerve. These include cortisol, your own body's steroids. These include TNF alpha and reactive oxygen species. And you can see very easily that comparing before and after, all of these are substantially changed after meditation. And so these factors are also affected with meditation as well. These actually go down with meditation. So it's a positive effect on these negative factors. And then the bottom row are these are the surveys of their quality of life. And the WHO here, as all of you know, is a branch of studying health. And we use those, they use those surveys to look at the quality of life. And you can see in the people who had the meditation group actually had substantial increases in their quality of life and all these aspects of quality of life. So overall, it was a very positive effect for meditation. The take-home points are that you had lower eye pressure, you had lower levels of these sort of toxic mediators, higher levels of the supportive mediators, and then better quality of life after going through this period of meditation. And I'm going to talk about a certain syndrome here. I'm looking like I'm going to diverge a little bit, but you'll see it's related to this topic of lifestyle and factors sort of outside of just intraocular pressure. And this syndrome is called Flammer syndrome. And I wouldn't be surprised if many of you who are listening have some aspects of this or have Flammer syndrome. I certainly see it in a lot of my patients. Some of it may be because of the geographic area I'm in. As you'll see, it's more common in women, among Asians, and people of high achievement, academics versus blue collar workers. And it's a vascular dysregulation. And as many of you know, the blood supply to the optic nerve is a large factor, maybe the most important factor in relation to glaucoma and glaucoma progression. And in this vascular dysregulation, there are high rates of normal tension glaucoma, pointing to the fact that maybe it's not really just the pressure, but it's really this vascular dysregulation that's causing the glaucoma. And these are some of the symptoms and signs that you can look for that are associated with Flammer syndrome. These include cold hands and feet, systemic hypotension, which means low blood pressure, low body mass index. And what that basically means is you're skinny. For your height, you're relatively skinny. And myopia, so people who are very nearsighted tend to have this syndrome. There's decreased thirst in these patients as well, increased sensitivity to pain, odors, and certain drugs, difficulty falling asleep. And these patients also tend to have migraines and tinnitus, which is ringing in the ears. And that's a nice segue to talk about blood pressure, which has already been mentioned by Dr. Van Tassel. Low blood pressure is really what's associated with glaucoma development and progression. There are a lot of studies to support this now. It's not just in a way, it's no longer theoretical. The results are pretty substantial that low blood pressure is a bad thing for glaucoma. So what are some things that we can do? Well, certainly you can measure your own blood pressure, and it tends to be women and younger women who tend to have lower blood pressure. And so that's something to watch out for. You can, or the doctor can coordinate your blood pressure management with your internist and avoid systemic hypotension, that is too low a blood pressure, particularly perhaps at night, for example, as Dr. Van Tassel had mentioned. And there's even this train of thinking that perhaps people with very low blood pressures systemically, just sort of physiologically, that perhaps they might increase their salt intake to try to increase their blood pressure. And many of my colleagues have suggested that. Sometimes I've suggested that to patients who just have pressures that are very low, like 90/60 or 80/50, that are just very low blood pressure. And I think this is the part that you may be most interested in. What are some other things that I could do or pills that I can take? So here's just a relatively small list. There's others as well, but here's probably the most prominent other supplements that you can take that I've listed here. And I won't go through all of them because of time limitations, but I'll go through the top three. And we'll also end with talking about niacin, which is sort of hot off the presses, and some information that maybe it is beneficial for glaucoma. So we'll concentrate on the top three. Black currant it's basically, it almost looks like a little bit of a blueberry. You wouldn't eat it directly yourself. I think it's very bitter, but you can certainly take pills of it. And all of these have small studies that suggest there may be of some benefit. For black currant, there's a 2-year study in which they looked at glaucoma that increased ocular blood flow, which is a good thing, slowed the visual field progression, and lowered the intraocular pressure. A shorter study with 4 weeks duration in healthy eyes showed that the eye pressure also went down. Mirtogenol, which you might have heard of, is basically bilberry and pine bark extract. And bilberry is basically a European blueberry. So I just think of it as blueberries. And one alternative that you could do is simply eat a lot of blueberries, maybe a pint of blueberries every day for some of my patients who don't want to take a pill. And there's some limited evidence in small studies. A 6-month study in healthy eyes showed that the pressure was lower and that there was improved ocular blood flow. Same thing in a group that was ocular hypertension. This is sort of pre-glaucoma, in which their pressures significantly went down. And also there was increased retinal blood flow in that group as well. A newer agent is palmitoylethanolamide. That's quite a mouthful, but it's basically shortened as PEA. And it's a fatty acid amide that's already naturally found in our body. So you're giving yourself kind of a higher dose of it. And it acts through the cannabinoid receptor activation. What that means basically is through a marijuana type of pathway to enhance the lower the eye pressure. And that's what it's been shown to have done in these small studies. A 2-month study showed that in people with glaucoma and high eye pressures, It lowered the pressure 3 to 4 points. And in a 6-month study, normal tension glaucoma, similarly, 3 to 4 points eye pressure lowering and improvement in the visual fields. Now, I'll end with talking about vitamin B3, also known as niacin, and also having different forms of it. You'll hear about it being described as nicotinic acid, nicotinamide, or nicotinamide riboside. And basically, this vitamin supports cellular energy production in your body. You need it. And it helps to support production of ATP, which you may have heard of as your energy molecule in your body. And it's deficient in glaucoma patients. So numerous studies have found that there may be a deficiency of this in people with glaucoma. So if there may be a deficiency, would taking it actually help you in glaucoma? So this is what I think is sort of hot off the presses that people have gotten some information about, which is the study that looked at 57 glaucoma patients. And in the treatment group, they received sort of a buildup of nicotinamide, 1.5 grams a day for 6 weeks. And then they ramped up to 3 grams per day for 6 weeks. And basically what they found in the study was the people who were taking the niacin actually had, or nicotinamide, had improved retinal function overall compared to the control group and improved visual fields compared to the control group. And so it seems to, in a way, work. But again, this is a small study. So again, we always have to kind of confirm this with larger based studies, but it's exciting sort of new results. And I think that's why many of you have heard about it. I've had patients ask me about it already, and we've talked about possibly using it. Would definitely coordinate with your primary care doctor, even though it's a relatively safe vitamin to take, there are some side effects. So I'll end with just summarizing that the current treatment, we have to reemphasize, is directed at the intraocular pressure. That's going to be the basis of how you're going to treat your glaucoma. But it's nice to know that there are some possible alternative therapies, and I've highlighted some of them that I think might be particularly interesting: meditation, blood pressure elevation, if it is significantly low, and possibly some supplements as well. Thank you all very much, and I look forward to your questions.
Thank you very much, Sean. Very informative. And it's now time for our Q&A with Drs. Lin and Van Tassel. So what we're going to do is answer some questions by category. The first category here is going to be exercise. So question 1, Dr. Van Tassel, what precautions would you recommend taking in respect to weightlifting?
You know, that's a good question. I saw that lighting up the discussion board also. I don't typically tell my patients that they have any restrictions. I think the benefit of exercise, as far as I can tell, outweighs the risks. I probably wouldn't take up powerlifting as a hobby if that isn't something you already do, but I don't think that it's important to cut back as long as you have close follow-up with your doctor and are being monitored. Obviously, I think if you have only one eye and that eye has already been severely damaged by glaucoma, that might be the circumstance when I would say that might not be a worthwhile form of exercise.
Powerlifting aside, would you have any concerns if a patient were to really push themselves and exert? Would this potentially be dangerous?
No, I think, mostly I worry about exertion right after eye surgery. And obviously your surgeon would want to go over specific precautions with you, but I don't have any reservations about exertion. There's one specific type of glaucoma, pigment dispersion glaucoma. And there is some evidence that things like bouncing or heading a soccer ball might cause pigment to be released in the eye, and that can elevate eye pressure, but that is unique to that specific type of glaucoma. So make sure you know whether or not that's your diagnosis.
Thanks. Dr. Lane, knowing you're over on the West Coast, I'll ask you this one. What about hiking or scuba diving or anything where altitude and pressure changes may be encountered by a patient?
Those are really good questions. There are some studies out there looking at that. They're not well substantiated. So one aspect of hiking is getting up to high elevations. Will that cause your eye pressure to be higher? And actually one of our colleagues who's in Denver wanted to look at that and compare to, the West Coast, and some of my colleagues here, whether being at sea level versus being up there in high mountains. So we don't have great evidence about that. So I would say people who like to hike, the benefits of the exercise from the hiking probably outweigh any changes in eye pressure, if there are any at all. And so I would emphasize that getting out and exercising is a good thing. The scuba diving question is very good too. There's evidence that if you go down very deep down, and I hope most people who are glaucoma patients aren't diving very deep, can increase the eye pressure as you might expect, because you just have higher pressure from being, very deep in the ocean or a body of water. I think that I forget the exact number, what you can actually pretty safely dive for most of the things that most people would do, unless it's very deep sea diving. I think I forget if it's 100 yards or a certain number that, to me, I wouldn't never go down deeper than that. So overall, it's very safe.
Thank you. And I'll ask you one more question related to exercise before we move on to sleeping related questions. Going back to the topic of yoga, would you recommend the plier position? I'm not familiar. I don't know if you are.
Oh, I do a fair amount of yoga. I don't know the plier. Dr. Lin?
No, I don't either. But I agree with you, Sarah, that definitely the downward dog, there's already been evidence that raises your eye pressure. So that's, I guess, one way of looking at it. We don't know what the plier is, but anything that takes your head below your heart, that's where the eye pressure can go up.
So I'm told it is folding forward with your legs straight.
Oh, I think that should be fine. I agree with Dr. Lin. I think my barometer is generally trying to keep your head at the level of your heart or above. And obviously, I think a lot of people are doing yoga remotely now, so it's a little harder to work one-on-one with an instructor. But I do think it's worth emphasizing yoga is infinitely modifiable to be safe for you. So I do think it's valuable, but try to keep your head above your heart.
Thanks. We're going to move on to questions about sleep now. How many pillows would you suggest glaucoma patients sleep with? And would you recommend a wedge pillow?
I think getting sleep should be prioritized as the very most important thing. And I think people are very sensitive to modifying their sleep. And so I think making sure that you can sleep in whatever position you're trying to achieve. I think perhaps 2 pillows is a little bit better than 1, but I think a full night's sleep with 1 is better than a face down night of sleep. So I think you have to customize a little bit. I don't think a wedge pillow is necessary, but I think if that helps you, that's great.
Okay, thank you. One more question on the topic. Some people use a CPAP machine. Is there any impact on glaucoma?
We know that obstructive sleep apnea, which is treated with the CPAP, is related to glaucoma. What's a little bit less clear, actually, and I think a little surprising, is whether treating obstructive sleep apnea is actually related to then reducing the risk of glaucoma progression. I think that at least the comment that was in the question box was also about the relationship between the CPAP mask and intraocular pressure. And I mean, a well-fitting mask should really fit kind of along your orbital bone. So I wouldn't expect that to elevate your eye pressure. Although ill-fitting, it can blow a substantial amount of air up over your eyes, which can be a source of really profound dry eye in some patients.
A fantastic segue for Dr. Lin here. Getting back to acupuncture, is there any evidence that acupuncture helps with dry eye?
Not any convincing evidence that I've seen. That's a good question. They've looked, obviously, I know the literature for glaucoma much better. But I think that it probably doesn't have that much substantial effect for the eye. There's been probably some investigations. I would tell you that we have such great treatments for dry eyes, obviously using artificial tears. There's also these medicines that affect in a way, the pathway, the mechanism by which dry eye forms. They're known as Azidra, for example, Restasis, and there are other ones as well. They're just so effective. I think that would really be my way to, conquer that disease.
Thank you. I'm not sure he's interested in answering this one, but there appear to be a couple different questions about caffeine and alcohol and how much of either would be safe for patients with glaucoma.
That's a great question. I actually thought it was too controversial to include in my limited slide deck because it's such an important part of so many people's days. There is some evidence that caffeine intake, a cup of coffee, can raise your pressure a point or 2. And that probably lasts for about 90 minutes after having the cup of coffee. I can't speak to a cutoff for milligrams of caffeine that is really safe or not safe. I think for most medical conditions, doctors have concluded that 1 to 2 cups or about 250 milligrams is probably okay. I don't encourage people to reduce their caffeine intake despite glaucoma, because I think that's a pretty necessary vice for a lot of people. But I don't know, Dr. Lin, do you tell them to cut back?
Well, I agree with you that the effect is small from studies.
Yeah.
And it really probably would be, some studies have shown that maybe 3 or more cups is where it's really statistically significantly you can measure it. And so if patients do ask me about it because they're worried, I usually tell them, yeah, studies show maybe over 3 cups of coffee would be significant. And most of them don't drink that much. You know, I don't know if I've ever had anybody drink more than 3 cups of coffee a day. So it's usually not an issue. So I agree with you. And I can touch base on the alcohol issue as well. Alcohol can actually lower the eye pressure because alcohol actually dehydrates you. And so it actually, in a way, sucks, fluid out of your body and in a way your eye as well. But we certainly wouldn't recommend that people start taking up drinking to lower their eye pressure.
It all comes down to quality of life. Thank you for the answers. Moving right along here, we've got some musicians on the line. I myself used to play mean clarinet. So the question for you then is, how do woodwind instruments affect glaucoma?
I can start off a little bit. There's been many case reports, case series about instruments where you actually have to raise your pressure by blowing, on this wood instrument or a trumpet, and it raises your eye pressure as well. It's kind of a vagal response, and it raises your eye pressure. They actually, what they do is they actually measure these patients' eye pressure sort of before and after, and it substantially goes up. I've even done that in some of my patients who've been part of orchestras, and their eye pressure substantially can go up. And I think in those kind of situations, you would want to work with your ophthalmologist to do this kind of testing in your own particular situation. It's recommended that you measure the pressure very soon after you play for a certain amount of period, and then maybe about a half an hour later to see what the eye pressure does. But there have been so many cases documented where people have developed glaucoma. It's hard to say whether that caused it, but it's very strongly suggestive that playing those kind of instruments can actually cause glaucoma in a way.
Very interesting. Dr. Van Tassel, do you have any thoughts around considerations patients should take in mind when they're thinking about driving, or any tips?
Oh, I mean, I think the first metric is for driving is, do you feel safe? I mean, I've had patients who tell me, I don't feel safe driving. Can you renew my driver's license? And of course not. I mean, if you don't feel safe driving, you shouldn't be driving. Whether or not you meet the legal criteria for driving depends very much on the state in which you live. In general, 20/40 with both eyes open is one of the more common metrics. And then whether or not your state includes a peripheral vision element to that varies. But a lot of low vision centers actually provide an opportunity to do a safe driving exam. And so you can work with an organization to check that out. And that has a lot to do both with your vision and also your response time, your reflexes, things like that. But I think following your own intuition, that of your family or trusted loved ones, and then your state's legal guidelines are important.
Thank you. For either one of you, I suppose, any tips for how to protect eyes from the sun?
I think you can't beat a hat and a pair of sunglasses. Whether they're polarized or not, I don't think matters. Although if you're like an angler or you like outdoor activities, you might prefer polarized. But most run-of-the-mill over-the-counter sunglasses meet the 98 or 99% UV threshold, and adding a cap or some kind of head protection can limit the amount that's coming from over the top. And limiting UV light has benefits not only to your eye health, but also to the skin around your eyes, reduces the risk of skin cancers. So I think eye protection and a hat is very important. No relationship to glaucoma progression, though, incidentally.
Good to know. Thank you. What about tips for folks sitting in front of a computer 7-8 hours a day?
I can answer that a little bit. there's no relationship of computer use or watching TV with glaucoma that's ever been substantiated. So that I hope that reassures many of you who are watching a lot of Netflix or you're on your computer all the time. In terms of just general recommendations, our academy recommends that you, every 15 minutes, that you stop staring at your computer or let's say a tablet or your iPhone and look away, look in the distance. It actually relaxes your muscles, which are, trying to accommodate and focus at the near. Also, it helps with dry eyes as well. When you look at a computer all day long, you're not blinking as much, so your eyes are drying out and you probably will need to use some artificial tears. So stop every about 15 minutes and kind of go have a cup of coffee or something else and come back.
Related to that.
Oh, go on. I'm sorry.
Oh, no, I was just going to say related to that is the question of blue light blocking glasses, which comes up all the time and came up in the chat that I was reviewing earlier. There's a brand new high quality study in the American Journal of Ophthalmology from last month that was a double-blinded study showing that there was not a benefit to blue light blocking glasses in terms of people's eye comfort. So I'm encouraging my patients to spend their money on other things, but not to worry about the blue light blocking glasses.
Interesting. Dr. Lin, you were talking about dry eye a moment ago. Do you have recommendations for how patients should space out their lubricating eye drops and their glaucoma medications?
Oh, this comes up all the time. I'm sure for Dr. Van Tassel and myself, is that because our patients are, a more older population, they will have more chance for dry eyes. The other aspect is that when you use glaucoma medications, almost all of them cause some ocular surface disease, which is a fancy way of saying, it's causing some dryness of the eyes and some problems with the tear film. So many of our patients, if not most of them, need to use some sort of dry eye therapy. And the question is how to space them. At least 5 minutes. So studies have shown that, you want to give 5 minutes, not only between an artificial tear and your glaucoma medication, but if you're using multiple glaucoma medications, 5 minutes is sort of an ideal time. Longer is better, but at least 5 minutes between the drops.
Great, thank you. Getting back to the topic of supplements, is there a hard and fast limit you would put on how many supplements you'd recommend a patient take?
That's actually a great question, and I didn't have time to kind of go into it a little bit, but you might look at my talk or you might look at some publications and look at all these lists of supplements and say, wow, there might be 5 or 10 or more supplements that can help glaucoma. I'm going to go out to the drugstore and buy all of them and start taking them tomorrow. I don't recommend that. I think most people wouldn't. I would say that maybe you might want to pick and choose. We've talked a little bit about which might be more effective, for example, and I would do one at a time. Again, this is all adjunctive therapy. This is not going to be your main therapy for glaucoma. But if you want to do something else and you think it might help, you might start off with, I'll just pick one. You might start off with the one with blueberries or bilberry and see if that makes a difference. And when you go to your ophthalmologist, see if it a change in your pressure. Keep your ophthalmologist up to date, of course, about what you're doing. But I don't recommend that you go out and buy all 5 because, first of all, there can be side effects. It's going to cost a lot of money. And they may not be doing anything at all. You really don't know which one's helping you.
All right. Getting back to the topic of meditation, is there a recommended duration a patient should practice to see some benefits?
Any duration you can do. Making it a habit, right? That's the hard thing.
Sarah, that's the bottom line. Because here I am presenting the study, which sounds so great, right? Your eye pressure gets better. All these factors in your blood that might affect glaucoma get better. Your quality of life is better. And so why aren't we all doing it? And I've told a lot of patients who've asked me, what else can I do about this? And when they come back, almost none of them are really meditating for any significant period of time because it's hard. And I tell them to start with just like 5 minutes. It's really hard to sit there and do nothing, so to speak, as you might say. And I just tell them to start with 5 minutes, as Sarah was saying, and build up from there.
Yeah, I think that's a great tip. And I say that as a lapsed Buddhist practitioner myself. So certainly can appreciate the challenges there. For Dr. Van Tassel, are there any over-the-counter medications you would recommend patients avoid?
I think the one that comes up most often in my practice is in patients with narrow angles or narrow angle glaucoma. You should avoid the common cough, cold, and antihistamine medications unless you've discussed that with your doctor or had the laser peripheral iridotomy laser therapy or you've already had cataract surgery. So I think that's probably the most common thing to be aware of over the counter. Otherwise, I think, most over the counter medications in the appropriate quantity and for a limited period of time are safe for glaucomatous eyes.
Any thoughts on steroid injections for a variety of reasons, aches and pains?
Yeah, that's a tough one. I saw in the Q&A a question about sciatica. I mean, back pain, knee pain, hip pain, it can be so debilitating. And so you really have to balance treatment of that condition with your own needs. I think it sounds surprising, but you can actually have an elevated eye pressure in response to a single hip or knee injection. That said, it's not necessarily a reason not to do it. I think you should discuss with your doctor how often you're going to need them. Typically, it takes 10 to 14 days to see an eye pressure response to a steroid medication, so you can plan a visit around that time. But I think all of this that we've discussed today, and steroids are no exception, is about balance. And we all know that your eyes aren't the only important part of your body. So.
Any tools, devices, or adaptive technologies that either of you would recommend for use at home?
Yeah, those are, those probably come more under low vision. And so for some of our patients who do have low vision issues, either very restricted peripheral vision, almost tunnel vision, as Dr. Van Tassel had mentioned before, or they in fact have very limited central vision from glaucoma or macular degeneration, they're probably going to want to see a very good low vision specialist. I'll be honest, I'm not an expert at, but there are certain magnifiers that you can use. You can use certain telescopes. There are also certain ads that you want to put in your glasses for macular degeneration. There's stronger ads for reading. There's also electronic, ways of actually, some of the older electronic ways are actually to take a book and put it underneath this what will ultimately be a magnifier, so you can read it on a screen with a more magnified view. I'm sure there are more high-tech ways, of course, with our cell phones and tablets and computers to improve our reading and our vision as well.
Great, thank you. We're going to ask one final question here before we wrap up. Any additional tips or bits of advice you would give that we have not covered so far?
I think Dr. Lin and I both mentioned it at the beginning of our talks, but it really can't be, no emphasis is too great. And that is to find a glaucoma provider that you like and trust, and to see them routinely. One of the biggest risk factors for glaucoma progression is loss to follow-up. And we know that pressure is the only way to manage glaucoma right now. So for most people, a pressure check requires a doctor's visit, although that's evolving over time. And so I think establishing care with someone that you really, really trust and making sure that that's a long-term relationship.
I would echo that, and I'll even give a little anecdote. Here we are, this topic of our conversation here is about lifestyle and alternative therapies, but I'll give the flip side of that. I don't want us to overemphasize this. I had at least a patient or two who went off thinking they were very holistic in their thinking. They just went off to do acupuncture and herbal therapy, and they came back with substantial loss of vision because they just believe so much in that pathway. And there are some of us who believe that. We want to be very holistic and non-drug using, so to speak. But this is a disease where the pressure is the number one issue, as Sarah was saying. That's really the main target. What we're talking about here is just something outside of that that's not completely proven yet.
Thank you so much, Sarah and Sean, for your wonderful presentations and for answering all of our questions. I don't know about everybody else on the line, but I've certainly learned a lot. Since this is World Glaucoma Week, after all, I did want to remind everyone, fellow patients in particular, you're not alone. There are over 76 million patients with glaucoma out there, and that doesn't take into consideration all the friends, family members, and loved ones supporting you. In addition, the Glaucoma Research Foundation always has your back. They're working to make a difference in the lives of glaucoma patients everywhere. As I mentioned earlier, they are really a fantastic resource where you can find answers to all of your glaucoma-related questions. They have informational booklets and newsletters available both in print and online, as well as videos. This content is available again on their website, www.glaucoma.org. If you have any questions, you can type them into the search box at the top of the website and you'll find some fantastic resources. For the social media inclined, Glaucoma Research Foundation shares a wealth of information on a variety of platforms such as Facebook and Instagram. Thanks so much to everyone who took the time out of their busy schedules today to join us and for your interest in the Glaucoma Research Foundation. Because of you, the cure is truly in sight.